Have you ever experienced a memory so painful that even years later it feels like it just happened? What if I told you there's a therapy that can help your brain to process that memory in a way that no longer feels so overwhelming? And that's where EMDR comes in. My name's Kelly. I am a forensic psychologist, CBT therapist, and EMDR therapist. So, to start off with, what is EMDR? EMDR stands for Eye Movement Desensitization and Reprocessing. It's a structured therapy designed to help people process distressing memories, often linked to trauma, but not always. It works by using bilateral stimulation, typically guided by eye movements, and this helps the brain to reprocess those memories in a way that reduces the emotional intensity. Think of it like reorganizing a cluttered bookshelf, so everything is then in the right place. But here's how it works. A therapist will ask you to recall a distressing memory while guiding your eyes back and forth. Similar what happens during REM sleep or REM sleep, when your brain processes emotions. This helps unstick the memory from the emotional part of the brain so it can be processed more like a regular experience. And unlike traditional talk therapy, EMDR doesn't require you to talk in depth about the trauma. Instead, it helps your brain to do the work naturally. It's especially helpful for people maybe who struggle to put their experience into words. As I mentioned, EMDR is widely used for trauma and PTSD, but it's also effective for anxiety, phobias, grief, and even performance anxiety. The goal is to help you to move forward without being held back by past experiences. A lot of people have asked, does EMDR erase memories? No, it doesn't. You still remember the event, but it no longer feels so distressing because it's been disconnected from that emotional part. Another question is, does it work for everyone? And so while results vary, many people can experience significant relief after a number of sessions. I want to give you a couple of examples of how EMDR can work in practice. So let's imagine someone called Sarah, for example, that she was in a serious car accident, but months later she still felt the intense fear whenever she heard screeching tyres, because that was the trigger. Through EMDR, Sarah revisited the memory whilst following her therapist's hand movements. Over time, her brain processed the event differently. She still remembered it, but no longer was triggered with the same panic. Let me give you another example. There's an individual, let's call them Jake. So Jake was bullied in school, and every time he walked into a crowded room, he felt like a helpless child again. But EMDR helped him to work through those old feelings, allowing his brain to reframe that experience. And now social situations don't bring back the same fear. Then if we think about working with anxiety, so Lisa struggled with chronic anxiety, especially in high pressure work situations. Even small mistakes would trigger overwhelming self-doubt. EMDR helped Lisa to uncover past experiences that contributed to her anxiety and reprocess them, allowing her to feel more confident and in control. Then if we think about with phobias, so an individual, David, had a severe flying phobia. Though the thought of just boarding a plane sent him into panic mode. But through EMDR, David processed past experience that had intensified his fear. And over time, he was able to take his first flight without overwhelming anxiety. Then think about how it can be used with grief. An example client, Maria, lost her father and she couldn't move past the pain. Every reminder of him brought back a wave of sadness that felt unbearable. But EMDR helped Maria reprocess her grief, allowing her to cherish memories of her father without feeling trapped in sorrow. So they're just a few examples of how EMDR can be used for a wide range of difficulties or areas that someone just wants support with. If you would like to know more, if you've got any questions, then please drop them in the comments. And as always, thank you so much for watching. Please like and subscribe, and I will see you soon. Take care.